And the reality is that many people get injured or they just can't figure out the right ways to engage. So what I do on the surgical side is really evaluate much more of what type of pelvis do you have? Can it receive? What are the things that I need to do to kind of allow it to happen? Can you do things on your own? Do we need to do stuff in the office? Do I need to do things surgically first to allow you to engage that you want to?
Hello, everybody. I am Michelle Melville-Cashon. I am the Community and Content Director here at Sexual Health Alliance. And today I'm with Dr. Evan Goldstein. Dr. Goldstein will be one of the keynote presenters at our annual Sexological Conference in Denver, Colorado this year. So welcome. Thanks for being with us.
Oh, thanks for having me.
Stay tuned till the end of this episode when Dr. Goldstein answers the question, what's a trend or habit you secretly love but are slightly embarrassed to admit? Can you tell us a little bit about yourself?
I'm Dr. Evan Goldstein. Thank you so much for having me and including me in this. This is going to be an awesome October speech. I started kind of sexual wellness about 15 years ago. I was thinking I was going to be a cardiac surgeon and I was going through that route. I was miserable. I came out in my life. I met Andy, my current partner. We have two boys, identical twins. They're almost 14 years old. And I started to kind of engage myself anally and start to explore. And through this, you start to realize that it's not just, oh, shove it in and you'll be fine. And then I started to say to myself, God, who delivers this type of care on a surgical perspective, on a plastics perspective? How does it function? How does it look? How do we get people to where they really want to be sexually, which I think is such a huge understanding of what do I want in my life from a sexual perspective, and then how do I, as an anal surgeon, kind of pair that so that people can engage the way that they want to. And that was really the birth of my surgical practice, Bespoke Surgical. And when you start doing community-based practices, you start to really see the faults, the issues, the things that people really need to focus on. And through that, you start to take care of communities, but you also realize that there's no products to support the way communities engage. And that was also the birth of my other company called Future Method, which was bridging science and really putting it into products that just decrease risk. And so it's been this like really cool world for me, which is really now, especially bringing it on the Sexual Health Alliance side, is really how do we kind of talk about all facets of what I do to benefit all the people that are coming and beyond. So it's exciting.
Yes, what a great way to fill a need within the medical space that, was missing, obviously.
100%. I mean, I think, you know, it's sad, right? It really shouldn't be missing, right? We look at like lack of sexual education. We look at, specifically sex, let alone gay and LGBTQIA sex. Like all of those topics are basically not taught at all. And then, we're learning from porn, we're learning from all of these facets of sexual, not even health, right? It's just sexual games. And the reality is that many people get injured or they just can't figure out the right ways to engage. So what I do on the surgical side is really evaluate much more of what type of pelvis do you have? Can it receive? What are the things that I need to do to kind of allow it to happen? Can you do things on your own? Do we need to do stuff in the office? Do I need to do things surgically first to allow you to engage that you want to? So there's a whole science about the whole, and that's what I'm going to teach at this conference, which I'm excited to spread literally the knowledge.
I love it. The puns are never ending.
Never ending, never ending.
That's fabulous. So, what are some of the most common issues that you treat at your practice?
Most of them are anal fissures, which are tears.
Yeah.
So, especially a couple of things, when you think about the pelvis, it's not overtly complicated. And I'll be talking a lot about muscle and skin and the kind of ways in which it helps us, but also hinders us, right? We have to think about the pressures of just pooping versus the pressures of sex are that much greater. And so how do we make sure that the muscles relax and that the skin can accommodate, all the while the mechanism working towards reducing pressure? So with that being said, that's a lot of what I see, which is the disconnect. Are the muscles too tight? Is the skin too fragile and tearing? How do we understand the connection also psychologically and neurologically to what people have functionally in the space? And so the first thing I see is, one is just that either people are way too tight and just can't feel comfortable receiving, or that they did receive and they keep tearing. And so then I try to figure out, well, what is the reason behind the tear? And then, like I said before, can we just do things with toys and stretching and working the mechanism? Do I need to add anal Botox, which relaxes the muscle? Or do we have to do certain techniques in the office to really build stronger skin in that space? Or do I first need to do surgery because the issue is so far gone, it becomes more chronic, that I first need to do surgery, which then brings people back into the realm of bottoming? So I say it's simple, but there's lots of things and nuances that we do and what we'll talk about to kind of allow people to understand the facets of everything as it goes into sex.
Yeah, that is fascinating. I never even knew anal Botox was a thing.
Totally. Yeah, it's a huge thing. But anal Botox basically relaxes the pressure. There's 3 sets of muscles in everybody. And the third muscle is the one that's really thicker, not so much in people born without a prostate. So people born without prostates at birth, they're really geared up towards pregnancy. So the muscles don't really need a lot of anal Botox. It's more the skin is so fragile and easily tearable in that space. So I think that's a lot of the stuff that we'll go over, which is a little bit of the nuances between different types of pelvises, and then prostate bearing, non-prostate bearing, and how do we kind of understand all of those facets.
Yeah. So in your office, do you primarily see people who are interested in having anal sex and feeling pleasure that way, or just like all anal concerns in general?
All anal concerns, but you know what you wind up doing is it winds up finding you, right? So when you provide a service and it's specifically in the anal space, and then people start to be really understanding the bottoming and the sexual side, most of what I do is geared towards appropriate sexual play. Right. And so with that being said, I see a ton of post-pregnancy, and a lot of these people do not want to engage anally at all. They just want to feel sexy and poop correctly and have fun in those regards, but they don't necessarily want full penetration. But most of what I do is tied towards anal health as it relates to successful anal bottoming. But I see all comers, all holes, all everything. But it just winds up being, you know, like anything, when you start to see 90 people a week and you're doing 15 surgeries a week for 15 years, you start to see patterns and you start to become that expert in that field versus being a general of, hey, I take care of everybody. When someone says they take care of everybody, they're only good at everything. They're not great.
Oh, I love that. Yes. And I think when it comes to anal health, you want somebody who's great.
That's right. I do. I do think you want that.
So, okay, what are some of the most common misconceptions that you hear from people about either anal health or anal pleasure?
Yeah, first is that I must be a homosexual if I take it up the ass. I think that that's a huge one. You know, I mean, I think that, that clearly is a societal pressure and a societal component to what the ass itself is. You know, I say anal is the final frontier of sexual world. And it's because of this, because, I think, especially in the male space, this heteronormative masculinity that becomes this, hey, nothing's going back there, or if I do engage in that way, am I, gay, or am I on the spectrum of that? And the reality is that we just need to start thinking about everything in life as being pleasure and not subscribing it to a specific compartment as it relates to that. I think that's the downfall of this. When you look at heterosexual men that are engaging in sex, their orgasms are just so much more heightened because of the prostate stimulation. And so you would never get to that amazing orgasm without play. And so we have a lot of work ahead of us, but things like your alliance and the press that we're doing and kind of looking at blogging and podcasting and really pushing out there, it's definitely more and more people which are looking towards engagement that allows them the pleasures that they think are there and are starting to feel more comfortable. So I think that that's clearly one of the big. The other is that, first of all, is that is dirty. It's a dirty act, and nothing should go up there, right? And we know that that's one, not true, and two is the fact that there's so many places like nipples and underarms and in the groin area that have such great positive nerve endings and stimulations that the reality is it doesn't make sense. If it feels really good for people, why not engage and utilize? I think the key is to learn the right ways to do it, to learn the right maintenance, to make sure that you are a community player so that we're all doing all the right things to keep it maintained, but also make sure that we're not spreading things. There's so much that goes into that and the myth busting of this, but it's a lot of the taboos that stay right up into it, and especially in pooping and stooling, and it's dirty and all this other stuff. So we got a lot of work cut out for us, but I think at the end of the day, when you look at the pleasures that people seek and get from it, and then what I can do to help them navigate that within partnerships and partners and all this, it's amazing what positive feedback we constantly get that gets me up every morning at 5 a.m. to do it.
Oh yeah, I can only imagine it's life-changing for people.
Crazy, super crazy.
If somebody's been experiencing pain or bleeding or all kinds of issues, and then they come to see you and it changes everything for them.
It ruins relationships, because in relationships, people are defined by certain acts that they are supposed to. Obviously, it's all in quotations, because what does that mean? But the reality is that it's super common. And when you are a bottom or identify as a bottom and you can't, it's catastrophic. It's suicidal. It's lots of things that can happen with that. And so now that we have the science and the sex-related components to get you into the wellness side, that allows you to engage the way that you want, it's been a game changer.
Yeah. So what advice would you give, what tips, if someone wants to try either sex or penetration or something for the first time, maybe their partner wants to try it, what tips would you give them to start out?
I think the key is first to try to figure out what type of pelvis and anatomy you have. And we'll talk a lot about this during the talk, but I think there are 3 types of pelvises in the world. And the first type is the muscles and the skin are able to open and relax and no issues. So about 1/3 of people, when they start engaging in sex, will do completely fine. 2/3 of people will have issues, and that 2/3 is split 50-50 with issues that we can work through, simple issues of dilating and stretching and physical therapy plus or minus anal Botox, and then the other half of people need more surgical intervention to allow them to get into the space that they want to. But it's figuring out what type of pelvis you are and what anatomy you have. And so a lot of what we do, and that was the birth with Future Method, which was, how do we create dilators that allow people the understanding of getting into anal? If someone comes to the office and they're like, I want to engage in anal, it's about 6 weeks of toy work, of dilating, of stretching. And the protocol is pretty straightforward. It's 2 weeks of just using a small glass toy And then it's 2 weeks of going from just the small, but starting with the small into medium. And then obviously the last 2 weeks, small, medium, into large. And by doing that, just like going to the gym, if you're lifting, biceps and you're doing 2 sets of 10, same concept, you'll do it on your own. I don't want any partners involved right now. You want to learn what you are capable of and how do you relax and how do you enjoy and how do you understand your pelvis. And then it's 2 to 3 times a week. And you'll just start to kind of toy around in a way that allows you to open up the muscle, get the skin strong, and learn how to control. And through that protocol, you're able to kind of see which group you're in, because some groups you'll feel like, hey, I'm having some pain, or I'm bleeding, or I feel discomfort, or I'm limited. And there's certain things that we kind of walk you through to allow you to then say, hey, what would be an appropriate next step? Many people come to the office, and in the office, not only am I looking and seeing, but I send you to our physical therapist where he does a specific muscle test, which allows us to know which group you're in. And so through you seeing me, plus the muscle testing, we're able to understand the muscle, the skin, the functionality, and then what would be the appropriate next phase. Is it just toys? Is it adding in Botox, physical therapy, and what's called a temperature device, which helps with the skin? Or do I need to do surgery? So a lot of it is kind of algorithm. But if you are using the toys for 6 weeks and you feel comfortable, small, medium, and large, and you're ready for sex, then yes, the next phase is bringing the toys into your relationship so you can use it as foreplay. Then you're going to kind of sit on top in control. Bottoms, many people feel like you have to be submissive to be a bottom, and that's total bullshit. You can also be submissive and in control. There's ways to learn how to do both. So a lot of that is kind of understanding everything as you're going through it. But people think you can go from nothing to something big right away and take it. And that is not what we're advocating for.
Right. That sounds like a recipe.
Totally.
Right. Well, that is so helpful. That's great information. That's so much more in depth than I had ever thought. That's great.
Yeah, it's a lot. There's a lot to think about, and a lot of cool things that I think we'll talk tremendously about in October.
Yes. Oh my gosh. I've already learned so much just from our show. I can't wait to hear you speak in October. So in your practice, do you ever partner with other providers like therapists, or do you do everything kind of on your own?
So no, totally different providers. Definitely therapists we do a lot of work with. I think, everybody's so busy, so it's really hard to kind of keep everyone attuned to what's really happening. So a lot of it is championing with the client and the patient to make sure that we're all aware of where we're at. But a lot of therapists refer to us specifically because people are not getting to where they want, and they've hit a roadblock with that. And so I do a lot of work in concert. In the office, it's me, it's a physical therapist, it's also a nurse that does a lot of aesthetic and functional work as well. So a lot of it is in-house. And then from a therapy perspective, it's really working in tandem with everybody, because once we get this working in concert with the functional side, then the sky's the limit, because it starts to really create so much more positive feedback with sexual play that a lot of the mental anguish and stuff. And I always say I'm about 60% functional work, 40% mental work. So a lot of that is once I fix the functional, then it takes us time to work to now allow people to say, wow, wait a second, it's not bleeding, or I don't have pain, or I feel really good. And you start to now say, oh, well, am I going to get injured with sex? And then we say, okay, let's start with the toys first, and then a partner that's really trusting. And we work on all of that to make sure that we're then able to hand back on the therapy side to allow that to succeed.
Yes. Yeah. I love that collaboration. So one thing I know we are always teaching our therapy students is like, when do you refer? How do you know when it's time to refer out to someone? So what would you tell like our therapists? Like, how do you know when it's time to refer to an specialist, an anal surgeon, somebody like you?
Well, I think first off is the reality is that if everyone has an ass, but if everybody is trying or engaging once a year, they should see somebody. Because just like you're going to a gynecologist, just like we're going to a dentist, it's really the same thing, which is there's so many things that are silent that you wouldn't know are happening unless someone is fully inside and out. Two is we're really able to understand the architecture and really start to make sure that are the pressures at the right level? Are they too tight? Are people getting too loose? And by having a yearly evaluation, we're really able to make sure that we're taking care of the entire body, right? And with that being said, I think also when you look specifically, obviously from an STD perspective, also an anal cancer perspective, similar to cervical pap smears, we do anal pap smears. So I think that if you're engaging anally, once a year check by an specialist is the go-to. But I think if someone is limited at all in any element of bottoming, the reality is that, you know, I usually tell people, therapists included, can go towards either our book. I wrote a book called But Seriously, which is all about everything we're talking about. But even, you know, just using toys and our protocol, many people, if they're engaging and they're like, hey, this is what's happening. Okay, how do you go towards the protocol and starting to see if you fall in line? If people are able to do the protocol in 6 weeks and feel comfortable, realistically, they should be in a good space and they can kind of follow that. But if there's any hiccups as it's relating, if there's pain, I don't feel pleasure, I'm bleeding, I'm having irritation, any of those, I think the realist, which is early evaluation, is key, because the earlier intervention that I get, I can set the stage for easy success, things that I don't need to operate on. But a lot of these people, it's continued issues. It's I'm ashamed. I don't have enough courage to go into the office to really see somebody. And that was a lot of the reason for Bespoke too, which was like, how do we just make it as a pleasant environment as possible? No taboos, no stigma, nothing as it relates to that, but allowing people to come in and say, hey, this is where I want to go sexually. I can't get there, and these are the things that we need to do. So I'm more of a proponent of early intervention, and I do a lot of stuff virtually with Zoom calls and collaboratively, so it doesn't only need to be in person. But the reality is that most people really, especially if you're engaging anal, should see a specialist to make sure that it's as optimal as possible.
Yes. Oh, that's such great advice. Thank you. All right, now it's time for our fun question. Okay, so we were going to go with number 2, right?
Oh yeah, what is that? Remind me.
What's a trend or habit you secretly love but are slightly embarrassed to admit?
A trend or a habit? Oh my God. That I see that I secretly love. Well, I think that it's just generationally. So for instance, the younger generation right now is just so fluid and on a pleasure perspective and not really putting labels to all the facets that my generation is. You have to be this, you have to be that. So I think that a lot of the really trying to learn on that fluidity side of allowing pleasure to just, and it can change, it can be different one week versus the other week, and allowing yourself the liberties of not feeling shame and feeling comfortable and allowing you to kind of just lose all of those inhibitions. So I hope I didn't skirt the answer, but I think that that's a lot of what I think is a trend, and realistically, every one of us should follow.
Yes. Oh, I love that trend. Yes. Thank you. All right. For anyone watching this recording, if you would like to hear more from Dr. Evan Goldstein, you're invited to get a ticket to our annual sexological conference. It's our 10-year anniversary happening in Denver, Colorado, October 9th through 12th, 2025. You can get your tickets online at sexualhealthalliance.com. Well, thanks again, Dr. Goldstein.
Oh, thank you.
All right. Bye, everyone. Thanks for watching our video with Dr. Evan Goldstein. Do us a favor, share this with someone who might benefit from this information. I know this episode was packed with useful info, so please share it with someone who might benefit. And your support helps us reach more people with this important sexual health information. If you're passionate about this space, we know you'll enjoy these videos, so check them out. Also, like this video, subscribe to our channel, and remember, you are exceptional.